Hello everybody, my name is Hassan Lumbia. I'm going to talk about contacting the emergency service by the first aider. Who is the first aider? The first aider is the person who render the basic medical service to a immediate incident that occur in an injured person. Yeah, I'm going to talk about 2 points. The first one is first aider will either contacting the emergency service themselves, or they ask someone by standards to contact the emergency system. Then number two, this can be achieved by remembering the code. What is the code? It's called Lion. Lion. That is LIONE for the first aider. What is Lion? Lion L. The L stand for location. Then the I stand for incidents that occur. Incident that occur. Then the O stand for other services. Yeah, like let's say fire or trip of cables. Someone is shocked. Then the N stand for numbers of casualty. Then the E stand for the exact types of injury that the person sustained. The first aider will be in any organization, is there to first render service to any victim that is immediately affected or by any incident that occur. Before the arrivals of this emergency system, the emergency service to the locations or this where the incident occur, I'm going to measure 6 points here before the arrival. Number one, the first aider always ensure that it is the safety for you to approach a casualty before attempting to carry out any treatment. Then number two, your safety comes first, you the first aider. So do not put yourself in any danger. As the first aider, you have to look the situation before you assist. Like for example, if somebody have a shock, that the person is immediately gets still in contact with the electrical shock, you have to make sure that you turn off that electrical power off before you can render help. Then point number three, ask what happened, if anyone saw the incident, or if there are any other training or personnel that are available in that location. Then number four, do not allow yourself to become isolated when dealing with an emergency situation. Yeah, you have to be like somebody is injured, like unconsciousness, or somebody is weak. When you are treating him, you have to make sure that you don't feel asleep. You have to keep him moving. Then point number five, taking control and obtained assistance from those around you, as their help may be required when casualty, or in sending them for the first aid box or casualty, or calling the emergency system. Like basically when incidents occur, like somebody is unconscious, you want to render the the CPR to the person. You just have to make sure that the people that are around you, they have to help you. Like maybe if you need to call the ambulance, you need to call hospital, so people around might be at help for you. Then point number six, you may be dealing with a multiple casualty, so assist is vital. Like in case of large fire or flood, so many people have injured. You as a first aider, right, you are there to help. When you are helping them, you make sure that people that are around you, you try to ask for their assistance in calling another team to come and help you, because to be a first aider is very important in every areas, in office, in business place. At least everybody should have a basic trainings of first aid, wherein you know how to do the CPR, how you can resuscitate someone. So you have to know that one, how you can, in case of any emergency, how you can handle that one. Then I'm going to talk about dealing with a casualty and the priorities, on prioritize the treatment, how you can deal with casualty and prioritize the treatment. Number one, first, the first aider should be applied to the following life-threatening conditions in the following order of priorities. Number one, casualty is not breathing. This simply means that if somebody, like you as a first aider, somebody gets injured or somebody is unconscious, is not breathing, what you should do. Then number two, several bleeding. You see somebody is bleeding, consistently is bleeding, so that means you have to call for the emergency immediately. Then number three, like burn or bone injury, so you have to call for the emergency service because your training is just a basic first aider. Then number four, you're talking about casualty is unconscious, like somebody is unconscious, right? Is not breathing, so you have to consult the emergency. You have to know how to deal with these situations, what to do. Then we are talking about the factor that involve in emergency system. When we are talking about the factor that involved in the emergency system, you have to always be conscious of the PPE, that is the personal protective elements. Because some certain incident that occur, if you don't have your PTT, your PEE, then simply you also be affected to certain situation. So you as a you as a safety or a first aider, you should always conscious of your gloves, your masks, and other gears that you should put on. In looking at that, you have to use the proper cloth and equipment to prevent causing of infection or contamination. Positive hazard can occur like traffic, electrical or water hazard, or building, fire or chemical, smoke, gas, or bystander. These are some of the hazard that might be happening. Then we're talking about assessing of incident, right? How you can assess incident or disaster. We're looking at the primarily having access the surrounding areas for any danger, or ensure that it is safe to approach. That I'm going to highlight 3 points. You have to access the area, that this area is safe for our approach if we are going to render help to someone. Then point number 2, you should now carry out a primary survey to identify any life-threatening conditions of this casualty. You try to assess this casualty. Like casualty means that the person who is being injured, so you have to assess if there is other things that will affect you around there, Then point number 3, you should remember that life-threatening must take in priorities and any other first aider treatment, right? Then I'm going to talk about another action that you need to take, you as a first aider, right? We have something that we call Dr. ABCD. Dr. ABCD. Dr. ABCD plan is to assess, to determine the priorities of your first aider and care in any life-threatening situation, right? That is number 1. Then the Dr. ABCD action plan will also assist you in assessing for the presence or absence of unconscious and breathing, and will enable you to determine the type of basic life support measure that you are going to take. This simply means that the Dr. ABCD, this is the plan that you are going to take. Yeah, you have to observe which kind of help this person need, right? Because I'm going to explain what is Dr. ABCD, right? Dr. ABCD mean the D stand for the danger. You have to check, right? Check the danger, then the risks that's involved in that area. Yeah, if it's an electrical shock or water fraud, or you have to assess what happened. Then the R stand for respond, right? If the casualty is lying down in the floor, you have to make sure that, if it respond, you have to check. After checking, then you can call the emergency system. So whilst you are trying to take control of that situation, whatever help you can help, you can help. Then the A, that is Dr. DRA. Then the A stand for airway. So you have to check the airway of this person, that the casualty that is lying down. You can check the mouth. Then with your finger, then you try to put his head straight up. Yeah, so for him not to bite his tongue, Then you have to check the B stand for breathing. You have to check whether this person is breathing normally, Then you check the nose, you check the cover of the mouth, then you check whether the person is breathing. Yeah. Then the C is stand for compression. What is compression? Compression is the one that we call the CPR, where you have to do 30 of this one in the person's chest to revive this person. So in my next topic, I'm going to talk about the Dr. ABCD, how you can render first aid with this type of kit, right? I'm going to explain how you can render first aid.